Okay, class. Sorry for the inconvenience. Now, when it comes to determining the preferred number and spacing of children and choosing the appropriate means to accomplish it, which is part of what is known as family planning, one has to take into consideration certain things that, first of all, your value system has to be in play here. For most people, this has to be at the center of the whole process. Some of it, your value system might be dictated by your religious beliefs. See, if your religious beliefs is to the point wherein you don't need any artificial means of family planning, you see, you see the possibility of pregnancy as a gift from God. And you are there to house that gift of from God from preconception or prayer to full birth. And most of the time, you don't care, or you are not as concerned as to how often or what is the interval between one pregnancy or the end of one pregnancy at birth and the start of another pregnancy, and see how many. So because it all depends, especially in today's society, there are some challenges that people are now putting almost a cost to children, who is very expensive to raise a child. Yeah. But why did we get that way? Because we have kids that can help replace us when we are gone. People have kids to replace, to keep the family line going, to keep community going, to keep societies going. So how well do you plan for those? Because right now there are certain countries that are faced with less number of young people. There are more old people than young people. So at times, family planning has to be something that people have to really think through seriously. And most of the time, the idea of your plan, most of the time, there are certain times wherein it's almost you only think of the self. There are times wherein people have to think beyond the self. And that's why even governments should be involved in helping those families who have kids, provide certain opportunities to help them to take care of their kids. There is the notion of overpopulation, where again, those people with their value system, certain value system, do not believe in those kind of data. But all the same, the data is there. is how do you interpret the data? But in the process of the family planning, one of the things that has to also be taken care of is the health of both the father and the mother, especially the health of the mother. The mother has to be healthy, really healthy, for her to be able to carry a healthy pregnancy to term. It's extremely important because a mother who is not healthy is likely to have an infant who is not healthy. That's why, in addition to before even, say, before preconception, there is need to make sure that there is, or to go to the doctor so that your physical health can be assessed. Because those things are extremely important. How physically healthy are you? Are you obese? Because if you are obese, then there is a problem there. That's going to affect the child. Are you diabetic? Are you suffering from hypertension? Do you smoke? Do you drink? How stressed is your environment? What sort of environment do you exist? Is this a conducive environment to raise a child? So because all of these factors are things that people have to be take into consideration. Is the community really involved? Do they have support systems, facilities to help young parents to take care of their infants? So these are all things that are extremely important. What sort of organizations are within your community to help? Unintended pregnancies. See, again, as I said at the start, pregnancy should not be unintended because everything being normal, if you are healthy and your partner is healthy, engaging in unprotected sex is going to lead to pregnancy. So these are things that we should try as best of them because when it's unintended, that leads to a lot of stress between either the father and the mother, or the father might even not be around. So that leaves a lot of stress on the side of the mother. a lot of emotional, and most of the time even social stigma. And this can contribute to a birth that could might not be as healthy as it should be. So intended pregnancies, everything should be normal. People have to know their body. If you're going to give birth to a child, you have to know. For some people, even know their ovulation period, when it is safe to engage in sexual activities without any protection. And again, certain value systems do not even encourage on you said any form of contraception. So is sexual intercourse the only way those two couple can really express love for each other when they are not expecting pregnancy? Because there are a lot of things in this, and there's everything, especially in advanced country, and more so in America. Everything costs money. Even a gift like a child, parent will be concerned as to how are we going to raise this child? What school should we send this child to? What sort of stuff are we going to provide for this child? So these are all things that, so the word unintended, try as best as possible to reduce those factors. And at times, it leads to this word unwanted or mistimed. Now, again, it creates a lot of problems. So these are things that, young people, especially those that are at childbearing age, should think seriously about some of these issues. Unintended pregnancies associated with negative health behaviors. See, most of the time, because it's unintended, first of all, people will delay a prenatal care because for some, for even just because of shame, they don't want to go to the doctor so that friends will know or people will know. That will delay the care that they need so much to be able to making sure that the features growing, within them is healthy. And see if the features has adequate weight. And some mothers will still continue smoking or using alcohol and other drugs. See, these are all issues that are associated with unintended pregnancies. And when prenatal care is delayed, it means health problems down the road. When the child is born, with a lot of health problems, and some kids will not even make it up to some infants will not make it up to 1 year, and this is more pronounced among minorities. Then you have the low body weight, inadequate weight, when the weight is less than 5.5 pounds. When a child is born with a weight less than 5.5, that is a low birth weight. And depending at the time of delivery, that will take some time to help that kid to fully develop its organs. And in some cases, again, leads to health problems as they grow. Part of avoiding the unintended: smoking, alcohol, and use of other drugs are really discouraged, strongly discouraged during pregnancy, before and during pregnancy, and if possible, even after delivery. Don't smoke around a child, an infant. The Title 10 Family Planning Act, federal government, federal programs that provide funds for family planning services for low-income people. Here, the aims is to reduce unintended pregnancy by providing contraceptives and other reproductive health care services to low-income women. Support 4,000 plus family planning clinics in the US. Approximately 4 million women receive care at clinics funded by Title 10, Title 9. Now, approximately 4 million women receive care at clinics funded by Title 10. So there are a lot of clinics, and at times most of the time is some of the funds can also be used to educate people as to certain preventive measures. It might be difficult, but depending on the age and the health condition of people, they should make sure that they take care of some of these challenges first. As I said, some of these are kind of depending on your beliefs. But childbearing is something that is a gift. It's a miracle. And most of the time, it should not be entered into in a casual way. It should always be considered that way. It's a gift, it's a miracle, and should be treated in a special manner. Then you have the gag rule, enacted in 1984, rescinded as of 2015. Evaluating the success of community health family health programs. Now, as with anything, government always has the right intention, but most of the time is its implementation always run into some problems that are guided, that are influenced by some of the disease of this country when it comes to racial issues. See, because some of these issues, even though there are federal federal means or forms of support, but there are times wherein minorities either do not take adequate advantage of some of these resources, or do not have access to some of these resources, or the way it's being implemented is not acceptable, condescending, not being sensitive to cultural issues. So the government, the federal government is doing much, much better with time. But still, with some of these federal programs, there has to be some cultural awareness, cultural sensitivity. And there should be a real sense of respect to the client. If you're going to provide this amount of money, this amount of service, you have to make it acceptable to the people that the service is intended for, or else it's just a waste of money. Cultural sensitivity is extremely important. So most of the time, just because there are some of these things available and this, you think everybody will go to it. Nah, at times again, especially a country with some historical baggage of racism, of inequalities, of services, it's people respond to their past experiences. Now, if their previous experiences were not as great, most of the time they are likely not to, or they might forgo this valuable service. So, again, where are the clinics located? Who are the people in those clinics? Are they culturally competent? Are they well educated? Do they really know what they're doing? Or they could have just been robots, just sending out, distributing things without the proper understanding that the clients need for these things to be beneficial or meaningful to them. Clinics have improved. The maternal infant care health indicators have shown large reduction in unintended pregnancies, abortions, and birth. Early year, publicly subsidized family planning clinic helped prevent 1.9 million unplanned pregnancies that will result in 860,000 unintended birth, or 810,000 abortion, and 270 miscarriages. These are all loss that could be avoided. And there has to be a level of education, especially young people, that sex in itself does not necessarily mean it's all fine. There's always something that comes with it, some sense of responsibility. And yes, there are also some situations wherein certain women are raped. Those are challenging pregnancies. Very, very challenging. Miscarriages. Most of the time, poor health of the mother, or the age of the mother. Because the older, after 35, increases the rate. Once the mother's age is after 35 and beyond, increases the rate for abnormalities to resurface. So, especially in today's climate wherein women are involved in their educational advancement, job attainment, and most of the time postpone those years wherein the probability of having healthy childbirth postponed. It's not a bad idea, but at the same time, these are also things that people should think about. Because after 35, there are probabilities for challenges to occur, for defects to be established. And are you ready to live with some of those defects? There comes your value system. Public health dollars spent saves 3.74 in Medicaid cost. You see, always when public health is properly used, it always saves money. Public health spends prevention. And when properly used, it always improves the health of the mother, the health of the child, the health of the family, and yes, cost society less money. But when we ignore some of those guidelines, that public health lays out, we set ourselves to suffer more and eventually even loss, increased mortality rate. So these are things that has to be, people have to think about it. Now here are some just, these are just some statistics. As I always tell people, with statistics, it all depends on who is reporting. And where are they getting all this from? Is it the real statistics, or this is just half of it? legal in early stages of of abortion is legal in this country in early stages of pregnancy since 1973, Roe v. Wade. So this was one of those laws. Since it was put in place, it has always become a fighting political issue. Those in favor of abortion, those against abortion, those in favor of abortion at all costs, those that are in favor of abortion under certain conditions, like serving the health of the mother or being raped. And this has been an ongoing, it has been an ongoing challenge. And I think some of these challenges, some of these could be addressed at areas wherein values are being formed, the values of could be possible, certain people who are religious, maybe. Now, unmarried people, unmarried women, most of the time is 85.3%. So that's a big number. But you know why? Most of the time, don't want the stigma, the cost, the shame, and just don't want the child. Then you have women aged 20 to 29, 58%. Rate highest among non-Hispanic Black women. Again, these are some of the issues where in at times, especially when you're dealing with governmental data, non-Hispanic Black women are likely to use government facilities to report their data for them to continue receiving funds. So, and also just based on possibilities of no job, environmental issues, housing issues. So these are all things that you can bring into play. But when it comes to those, these are issues that society has to really spend some time to address some of these issues in a way as to not playing so much politics in it, but at the same time helping people that are involved that are dealing with these issues to be able to deal with them in a healthy way possible. You have the pro-life versus pro-choice. Maternal health. Now, effect of pregnancy and childbirth on women, important indicators of health. The effect of the pregnancy. Is it a healthy pregnancy? Because most of the time, if the mother is pregnant and the mother is healthy, the mother is maintaining good weight, the mother is not hypertensive, is not diabetic, does not have cholesterol issues, eats healthy diet during pregnancy, does not smoke, does not drink alcohol, everything being normal, there is a higher chance of a healthy pregnancy and a healthy childbirth. And also, during pregnancy, going for frequent medical checkups. See, if they go for physical, go for prenatal care, go to their obstetrician for checkup, see how is the developing child, the developing features is going on in the womb of the mother. Child developing properly. Are they developing at the appropriate age? Because most of the child, the first 3 months of pregnancy, it's very, very, very important in determining the health of the child. If those 3 months, the first trimester, they call it the first trimester, the first 3 months. If those 3 months, there's any deficiency that the child experiences, or any toxicity that the child experiences due to smoking, drinking, and all those, they can impact the child's health. First 3 months, extremely, extremely, extremely important. Mothers should stay healthy, try to be healthy, try to eat right, stop smoking, stop drinking alcohol or other drugs. If you expect to have a healthy childbirth. And most of the time, again, as they said, the health of the maternal health of the mother and the child says a lot about the sort of society we have. It's very, very important. It's not only the pregnant mother, but also the child speaks volume about the sort of society that we have, that could have a pregnant lady, a pregnant woman who is carrying an unhealthy pregnancy, which, everything being normal, could lead to an unhealthy birth. Pregnancy and delivery can lead to serious health problems. So when the pregnancy is not healthy, whether the child is too small due to malnutrition, smoking, and other issues, will delay the development of the organs of the child. And that can lead to some problems. And also the mother, a mother who is hypertensive, who has heart problems, who has other disease, chronic conditions during pregnancy, if not properly monitored, could lead to death, maternal death. That's why if you look at the literature, the maternal death among African American women is very high. Some of it is biology, and some of it can also be quality of service. But if you look at the literature, the maternal death of African American women, regardless of education, is much higher than any other group in the United States. So those problems should be monitored. There is need for prenatal care. Prenatal care. Check the whole thing. Because again, you look at the foundation. Is the foundation strong enough to be able to, is the mother healthy enough to be able to carry a healthy pregnancy? If not, can we work with the mother so that she is healthy enough to be able to carry a pregnancy? Because it's extremely important that the mother and the child are both equally healthy. Because if the pregnancy is unhealthy, most of the time, the mother dies at child delivery or immediately after child delivery, or can have some complications that will just lead to disability down the road. So let's make those conditions, those physical checkups, those relations with the doctor and the pregnant woman healthy, so that the pregnant woman can explain how she feels. And the doctor has to listen, not just look on guidelines, generalized guidelines. Some of these things are specific to the individual. So yes, as they go through the medical process, there are general guidelines. You check for this, check for this, check. But as we have seen, there are always variations from individual to individual. And some of those variations need to be studied more and need to be taken care of when possible. Because ignoring those variations leads to loss of life. Maternal mortality and morbidity rate is high among minorities. Causes include poverty and limited education. But now, in fact, it's not only limited education, even the educated Blacks, minorities, experiences some of those challenges. So there has to be a real push, a real interest to really understand some of those causes that leads to minorities losing their infant as well as their women at childbirth. At times it's hemorrhage. It's a host of issues that's why you check the blood pressure and also check the diet. Check some of those other issues. What are some of the stress related issues? What are some of the socioeconomic conditions that predisposes African American women to die more at childbirth than others? Insurance related issues. When do they really start going to the doctor for medical checkup? Because it's one of those, first of all, it's almost like you're going to be having visits, you're going to have let's just imagine President Obama is coming to visit your home. What do? You do big time cleaning. You clean, you make sure everything is in the right place, and that is why you don't even wait until he comes. Most of the time, if you know he's going to come 3 months before that visit, you start to prepare. See, because again, childbirth is still a miracle. But now we know a lot about some of the things we need to do. Do away with some of those behaviors that can promote health problems. Our diet, emotional status, family history. These are all important. And the age. See, age in the teens, most of the time, for some people, the reproductive system is not properly developed. Pregnancy can occur, but it's not properly developed. And in case of any challenge, infections or whatnot can lead to either miscarriage or problem for the mother. So preconception care, medical care provided to women of reproductive age to promote health prior to conception. As I said, 3 months before Obama comes to visit your house, everything is clean, everything. You go to the doctor, he says, okay, maybe you need to cut down on this. Don't do this. Well, start exercising, start eating right. Start to reduce your stress so that when conception comes, when you engage in that sexual activities and when you engage in sex and fertilization takes place, then now the house is clean. That child is developing in a clean environment, in a healthy environment. Now Obama has come. Now he is in a clean environment. See, let's look at our kids as great, if not even greater than the former president or former president or former celebrities, because they are just as valuable and could have all the possibility to be the next president. So we should not take this lightly. Pregnancy should not be taken lightly. You cannot be going with your life as normal during pregnancy. There has to be some changes for the health of the developing fetus, for the health of the developing embryo, the fetus, and the infant. It's a sacrifice that needs to be made with a great reward by having a healthy child. Prenatal health care, very important. Most of the time, some people don't have insurance. That's why most of the time people go to medical facilities or clinics that are funded by the government. They help with those. But it's extremely important, because regardless of all the cleaning, the behavior changes that the mother can make, things can still happen. But when caught very early, those things can be corrected. And when corrected early, can lead to a healthy birth. So it's extremely important, as people, as women try to engage in childbearing. Here, I'm also talking about the male. The male has a part to play. Play that support, emotional support, to reduce the stress level, to give that mother that confidence that I have somebody who loves me. Not only loves me, but loves me and the child that I'm going to bear. And also at times also provide certain support, because it's extremely important for those things to be taken into consideration. Less likely to go give birth to early and continuous conceptions. Less early and continuous preconception and prenatal care can lead to better pregnancy outcome. Less likely to give birth to a low birth weight infant. Again, here, these are all various, the level of people talking about their level of education, timing of prenatal care initiative. When do they really start going to the doctor? Say people with less than high school and diploma. It's very high. First of all, they are the age wherein not married, are ashamed to even tell their parents about it, afraid of the stigma. So they stay with it until when it starts to show. And by then it's too late. As I said, the first trimester is extremely important. The first 3 months You and your doctor should be speaking the same language. You and your doctor should be working together to making sure that the child within you is developing in a healthy manner. They can continue to the second trimester, the third trimester. It's a part of this table also deals with your socioeconomic status. Less than a high school, your socioeconomic status is not much. High school diploma, maybe you have a job or some college or associate degree. Yeah, you have a job. Bachelor's degree or higher. You see, the more education you have, the better the outcome. The less education you have, the less the outcome. So, the infant's health depends on many factors. Mother's health, her health behavior prior to and during pregnancy. So the health of the mother is very, very important. Prior to, before, during pregnancy is very, very important. Genetic characteristics. Again, those traits that we inherit. High blood pressure, in some cases, obesity. These are all things that could be a factor. Mother's level of prenatal care, the sort of care that they get. How frequent? How valuable? Do they really ask does the doctor ask the right type of questions? If not, does the mother present those questions? Are they properly answered or ignored? Because as we say, two people can be feeling the same thing, but what causes that sort of feeling can vary. So it's better you address every patient as an individual. Quality of delivery. Then you think of the infant's environment after birth, the home, family, and medical service. Healthy environment, supportive family, necessary medical service, type of nutrition. Are they fed with the right type of nutrition to help them develop their own immune system? And yes, vaccinations. Are they getting the appropriate vaccinations? So these are all things that needs to be addressed. And I would like to stop the class here today so that there are enough things that you can chew and think about. And if you have other issues that you want me to address, please send me an email or use the chat as I present this so that I can look at it and see. because this is very, very important. Some of you at that age, wherein you start thinking about having babies. Some of you might have already, but that's okay. The key thing is we want the mother to be healthy and the infant, the child, to be healthy so that we can reduce the infant mortality rate.